So my name's Andrew Welling. I am a third-year dental student. I'm from just outside Salt Lake City, Utah, and I have affiliations with the University of Iowa in the sense that my dental mentor growing up, he went to the University of Iowa. His name's Jason Horgesheimer. He's a pediatric dentist in Utah, and in his eyes there is only one dental school in the country, and that's the University of Iowa. Yeah, so the D3 rotations was actually one of the big reasons I chose the University of Iowa. The D3 rotation, so unique from other programs, our third year, we rotate through different dental specialties. So what that means is when we're learning how to do a crown, we're learning from a prosthodontist or someone who specializes in those types of procedures. When we're learning how to do a root canal, we're learning how to do that from an endodontist. So it's a really neat opportunity to learn from people who are specialized in that area, but also what's unique about Iowa is that we get to do large quantities of those procedures in a short amount of time. For me, that's really helped in being able to gain confidence in doing new procedures. When you're able to do, multiple root canals all back to back to back, you really gain confidence, and a lot more so than I think if I had to do one at the beginning of the year and just wait until another patient walked through the door who had that same need. So it really allows us to refine our skills and our clinical skills. So when fourth year, when we go to comprehensive care, we have the skills necessary to be able to treat our patients to the best of our abilities. Yeah, so I've had a couple cool research opportunities. So my first research opportunity, I've been studying the development of craniofacial asymmetries. It's been a really eye-opening experience to see how much that goes into it, but Iowa has an incredible research program. My mentor has really helped me learn how to be independent in the research process. So it's been cool to kind of go through those steps and feel that I could now independently create my own research. But one of the funnest parts has been being able to have the opportunity to then go and present that research. I've been able to do that at local conferences, regional conferences. I'm going to Chicago this weekend, and I also had the opportunity to go to Florida this past month, and so I mean, who's going to not going to Florida? And it's an incredible opportunity that the school gives you where, I mean, they paid for my airfare to be able to go and have that experience. And not only is it just fun to be able to go and present and maybe go to a fun destination, but it gives you more of a bird's eye view of what's going on in the dental community as a whole across the country. You're able to see the work that other students are doing, other professors, and it gives you a better idea of the new things that are coming in dentistry and really what's at the forefront of research. So my plans currently is I'm going to apply for orthodontic residency this summer, and so what that would mean is that if I'm able to get in, then it'd be another probably 2 to 3 years of schooling and then to go out and work. It's been really cool being at Iowa, where they're one of maybe 2 programs in the country that have all recognized dental specialties in-house, that I've been able to go and spend some time at the orthodontic department, and I've been able to see firsthand what an orthodontic residency is like if that's something that I wanted to do. I've been able to hear what that experience has been like with the residents and with the faculty, and they've all been so gracious to allow me to ask them questions to pick their mind. And so if specialty is something that you're interested in, I think it's such a valuable resource to have a residency program at the school that you are, so you can really see what it's like to be a resident or to be a specialist and really see if that's the right fit for you. So I'm married. I came here married. I now have a 1.5-year-old, and we have another one on the way this summer. And so coming to Iowa, it was something that was new. We didn't really know anyone when we first got out here, but my class has been awesome. That was probably the thing that I was most surprised about. Not that I thought my class wasn't going to be good, but being from Utah, I didn't know much about Iowa, things like that. But my class has been incredible. They're all people who I was surprised that not only did I enjoy them in the classroom setting, but they were people I wanted to hang with outside of the class. And so we do lots of intramurals, we play lots of sand volleyball, and so that's something my wife liked, and so she got to meet classmates that way. We do class barbecues, tailgates, all sorts of things. So it's been something that it's not only become, you know, my little dental family, but I really feel that they've incorporated my wife into that, and that's been fun for us as far as having, you know, this experience at this time of our life here in Iowa. I know for me, when I applied for dental school, I knew nothing about dentistry. I didn't know what to ask at interviews. I didn't know what was important. If you know those questions, you're a lot farther along than I was, so kudos to you. But a big thing that I would want to know is when you begin to gain clinical experience, and really ask what that is, because I think, you know, there's different ranges of clinical experience. Something unique about Iowa is you are treating patients. You treat family and friends, doing cleanings and things like that at the end of the first year, but the beginning of your second year, you're drilling on a patient, you're doing fillings, and from friends I've talked with across the country, that's unique in the sense that a lot of people don't start till the end of their second year, or maybe the beginning of their third year. So having that early clinical experience, getting comfortable with patients, learning how to work and talk with them as well as do those procedures, you know, that's really what you're coming to school to learn how to do. So for me, that has been such an important and fun aspect of being here at Iowa, was the opportunity to get in and begin applying those things that we learned early in a clinical setting.